One day, a patient with type 2 diabetes came to my office, carrying a whole bag of colorful bottles. "Doctor," he asked, "will these vitamins help me beat diabetes?" I smiled. It's a very common question. Indeed, many diabetics wonder if the solution to their problems lies in a handful of vitamins. The pharmaceutical market is flooded with supplements promising to normalize blood sugar, and it's easy to be tempted by the idea that taking magic pills will fix everything. As a doctor, I explain that vitamins are not a cure for diabetes, but they can be helpful allies. I asked the patient to lay his bottles out on the table and started explaining. I told him that vitamins are micronutrients essential for normal bodily functions. In diabetes, metabolic changes can affect the levels of vitamins in the body. Studies show that people with diabetes often have lower levels of certain antioxidant vitamins, particularly A, C, and E. It's likely the body uses up more of these substances trying to counteract oxidative stress caused by high glucose levels. It's also been observed that diabetics often have lower levels of some B vitamins, such as thiamine, B1, pyridoxine, B6, and biotin, B7. The widely used medication metformin can also impair the absorption of folic acid, B9, and vitamin B12, meaning long-term users often need additional support. Additionally, people with low vitamin D levels are more prone to diabetes and its complications. So, it's no surprise that vitamins are a hot topic in diabetes care. I explain to the patient that vitamins may improve overall condition, but they cannot replace diet or glucose-lowering medications. In fact, no study has confirmed that vitamin supplementation can consistently regulate blood sugar levels. They're not an alternative to insulin or diabetes pills, but they can be a valuable complement when used wisely. We agreed to go through each important vitamin together, would explain its role in diabetes, what research says, and how to use supplements safely. Let's start with antioxidant vitamins, which I call the shields of our cells. In diabetes, elevated glucose causes oxidative stress, harmful free radicals form and damage blood vessels, nerves, and other organs. Vitamins C and E are the main antioxidants in our diet. They help neutralize these radicals. It's no coincidence that people with diabetes often have lower levels of these vitamins compared to healthy individuals. There's also data showing benefits from vitamin C supplements. One study showed that a 3-month course of ascorbic acid combined with vitamin E reduced fasting glucose and blood pressure in diabetic patients. These aren't miracle effects, of course, but they support the idea that ensuring adequate vitamin C is beneficial. I advise my diabetic patients to eat more vitamin C-rich foods, citrus fruits, berries, bell peppers. If diet alone doesn't provide enough, moderate supplementation, e.g., 500 mg daily, may be considered with a doctor. Vitamin C is water-soluble and excess amounts are excreted in urine, but very high doses, over 1 to 2 g/day, may cause digestive issues or even kidney stones. Vitamin A, retinol and carotenoids, is known for supporting vision and also plays a role in immune function and skin health. Epidemiological studies show that people with higher blood levels of beta-carotene, a vitamin A precursor, have a lower risk of developing diabetes. This suggests a role for this vitamin in metabolism. Therefore, diabetics should ensure adequate vitamin A intake from food. Carrots, pumpkin, spinach, and other orange and dark green vegetables are rich in carotenoids that the body converts to retinol. However, excess vitamin A from supplements can be dangerous. Retinol accumulates in the liver and can cause toxicity, hypervitaminosis A. So no self-medicating with concentrated vitamin A. A balanced diet usually covers all needs. The large family of B vitamins works as a team in our bodies. They help convert food into energy and maintain the nervous system, which is crucial in diabetes. Studies show that people with diabetes often have deficiencies in some B vitamins, especially those who've been taking metformin long-term or have a one-sided diet. B1, thiamine, and B6, pyridoxine deficiencies in these vitamins are linked to diabetic neuropathy, nerve damage. Both are essential for glucose metabolism and healthy nerve function. Diabetics have been found to have lower B1 and B6 levels, and studies show that thiamine supplementation may relieve neuropathy symptoms. For example, trials using a thiamine derivative, benfotiamine, significantly reduced pain and numbness in diabetic neuropathy patients. B12, cobalamin, and B9, folic acid. These vitamins support the nervous system and blood production. Unfortunately, 10 to 20% of diabetic patients on long-term metformin therapy develop B12 deficiency. This can lead to anemia and worsening neuropathy. These patients should monitor B12 levels and supplement if needed. Folic acid helps lower homocysteine, a metabolic byproduct that damages blood vessels. Folate supplements in diabetics have been shown to improve glucose metabolism indicators, like HbA1c and insulin resistance. Other B vitamins, niacin, B3, in high doses, may increase blood glucose, so it's used cautiously. Biotin, B7, has shown potential to lower fasting glucose levels in studies, but its role in diabetes treatment is still under investigation. B2, riboflavin, and B5, pantothenic acid, are also important for metabolism, though their direct effects on diabetes are less evident. Overall, diabetics should ensure sufficient intake of all B vitamins through diet, whole grains, lean meats, leafy greens, and consider supplements if deficiencies are present. Now let's talk about two fat-soluble vitamins, D and K, which are drawing growing attention in diabetes care. Vitamin D is called the sunshine vitamin because it's synthesized in the skin under UV light. It regulates calcium metabolism and affects immunity and various metabolic processes. Vitamin D receptors are found even in the pancreas, in beta cells that produce insulin. Observational data shows that people with higher blood levels of vitamin D have a lower risk of type 2 diabetes, and D deficiency is often found in diabetics with complications, cardiovascular, retinal, etc. However, not all vitamin D supplementation trials have shown positive outcomes. For instance, in a large randomized trial, D3, 4000 IU/day, didn't reduce the progression from prediabetes to diabetes compared to placebo. So there's no universal recommendation to use high-dose vitamin D for diabetes prevention. However, correcting a deficiency is important. It improves overall health and may help with glucose control. Diabetics should aim to keep their 25-OH/D blood levels in the normal range, using supplements if necessary. Vitamin K is traditionally known for its role in blood clotting, but recent research links it to glucose metabolism as well. There are two main forms, K, found in leafy greens, and K2, in fermented foods and liver. Observational studies suggest that people who consume more vitamin K are less likely to develop type 2 diabetes. One possible explanation is that vitamin K activates proteins that influence insulin sensitivity. Its role in diabetes prevention is still being studied, and there are no formal supplement recommendations yet. However, one thing is certain, don't suddenly change your vitamin K intake if you're taking warfarin or other blood thinners. Excess K can weaken their effect. In general, diabetics should eat green vegetables daily, for K and many other benefits. This supports metabolism and vascular health. To summarize, vitamins can positively affect the course of diabetes by supporting metabolism and helping prevent complications. We've seen that maintaining adequate levels, especially of D, B12, folate, and antioxidants, can improve a diabetic's condition. But no vitamin is a cure for diabetes, they are not substitutes for diet or insulin. Leading medical organizations do not recommend routine use of antioxidants or vitamins without clear deficiencies. Instead, they encourage getting nutrients from food and only correcting confirmed deficiencies. Vitamins are generally safe, but in excessive doses, they can cause harm. Some important cautions. Vitamin A, excess accumulates in the liver and may cause toxicity, liver, bone damage, etc. Vitamin D, overdose can lead to hypercalcemia, nausea, weakness, kidney stones. Vitamin E, high doses increase bleeding risk, especially in people on warfarin. Vitamin B3, niacin high doses can raise blood sugar and cause other side effects. Vitamin B6, pyridoxine chronic intake greater than 100 mg per day may cause nerve damage, neuropathy. Vitamin C, excess, 1g/day, may increase risk of kidney stones in predisposed individuals. Vitamin K, not toxic itself, but excess interferes with warfarin and similar anticoagulants, clotting risk. As we see, more is better doesn't work with vitamins. Balance is key. I recommend every diabetic patient, first, ensure a varied diet rich in natural foods. In most cases, that's enough to get all needed vitamins. If lab results or symptoms indicate a deficiency, then targeted supplementation can support your primary treatment, under medical supervision. This thoughtful approach allows you to harness the power of vitamins for better health, without unnecessary risks. Stay well.